So usually after this, you could stand the patient up after you do the adjustment and then show them where nice, normal, healthy is. These are drop tables. For those who don't know, they drop. There's an added extra benefit to the adjustment. The free fall and gravity. I won't go into the detail on the neurobiomechanics of that, but it helps a lot. Nice. Deep breath in. Good. Maybe slide back down a little bit. Perfect. Beautiful. Lay on your side, face me. Perfect. No shoulder injuries here. Nope. Good. Nice. Keep the bottom leg straight and strong. Straight and strong, straight and strong. Perfect. Let the top part relax. Good. Let this hip drop. Good. Let your hip drop. Nice, beautiful. Lay on your back. Good. Most people adjust pretty well in the beginning. Some people that have been fixated for a while or that have a lot of degeneration, spinal issues. Even if you have surgical fusions, get in here. Well, we work with surgeons. There's a reason why we work with surgeons. We have equipment that if you have a specific fusion in a segment, we'll use the equipment to adjust you there. We won't necessarily do manual adjusting there, although the drop pieces are perfectly fine for surgical regions. Because in fact, if you do not get adjusted, you run the risk of what every single surgeon will tell you, which is called ASD, adjacent segment disease, or adjacent spinal disease. And that's because the areas above and below the surgery compensate and become way too hypermobile. Nice. Good. Give yourself a big hug. Good. Perfect. Stay nice and relaxed. There we go. Beautiful. Research, even though none of you love research, but I bring it just in case you want it. If your head is rotated to the right, you put the cap on, right? We might have you do this here, we might have you do it in the gym, but you're gonna allow it to bring your head to the right, and then your exercise is gonna be rotation to the left. This is not set up properly, but you get the point, right? The band would be down a little bit lower to the point where you can, and it would be tightened so that you can start here and then you rotate to the left. And what you're doing effectively is you're contracting and strengthening the muscles to turn your head to the mirror image of what your spine is currently in. And then when we redo the x-rays at the end of care, or when we redo x-rays to get you progress update throughout your care, which is typically towards the end of the first phase of correction, we get to see how well you guys did with your homework at home, whether it's the cervical traction, whether it's the mirror imaging exercise you do at home, the orthotics that we'll show you in a minute, or the wobble. We get to see how well you guys did with at-home care. And that's what the x-rays are for. And then we get to see how well did the traction take, and how much correction do we have left to go, or can we graduate you to maintenance care. So follow us, we're gonna go to the next room. So this is a piece of traction equipment. We're gonna go ahead and set Greg up in the traction. And again, this is all based on his x-ray imaging. The most important thing for the x-ray imaging, besides knowing who you can adjust and who you can't adjust, is the traction. This is gonna go directly off the x-rays. This is extremely specific, unlike the part of the correction, which was the stimulation with the hyperpercussion instruments or the vibration instruments. That's obviously global. Sometimes we'll do global adjustments in the mirror image, but this is specifically catered to what your x-rays show. And if you get stuff for at home, Quite a few patients get orthotics for home. We teach you exactly where to use this. We're gonna have you use it in the clinic for a couple weeks, maybe even a month before we send you home with it, because we wanna make sure you guys are doing it right. If we do that, we're gonna teach you how to use it, and then when you go home and use it, we want you to be extremely specific. This gets one segment at a time, which is why you don't buy and don't ask us. You can ask us, but I'm telling you the answer now. Do not buy the stuff on Amazon. It's not cut. This is based off of medical research, years and years of it. And these are cut specifically to the ideal curves of your spine, which we go over in the report of findings and which are in your printouts that you guys get to take home with you. All right, so we're gonna shut off the camera now, and then we'll jump back in when we have Greg set up on traction.